These are great times actually for patients and physicians dealing with chronic lymphocytic leukemia, meaning that in the last few years we gained very effective therapeutic agents in our armamentarium, and nowadays we are not using chemoimmunotherapy anymore if we have access to targeted agents, and I consider this a great achievement in the last decade. But still we are facing new issues and challenges, including patients who have become refractory to both BTK inhibitors and BCL2 inhibitors, because nowadays there are limited options. I know in US there are non-covalent BTK inhibitors approved for this type of patients. We don't have yet them available in Europe. But in the next future, I dare say, besides non-covalent BTK inhibitors that are very promising and very effective agents, we will also see efficacy and safety of BTK degraders that are drugs targeting the same protein in BTK, but instead of inhibiting BTK, they are degrading the protein. So they are working both in inhibiting the kinase activity of BTK, but also the scaffold function of the protein. So they seem very effective, and I hope in the next future we can use them more because I think they are very promising agents. And beside them, in US also CAR T-cell treatment was recently approved. I think we still need to optimize the way we are administering CAR T in our patients with chronic lymphocytic leukemia, because we need to achieve deep responses in a higher proportion of patients. So far the complete response rate was about 20%, so in heavily pretreated patients. So this is again a great achievement, but we need to improve on it, because only patients who achieve deep responses, and in particular complete responses, can obtain long-lasting disease control. And we also need to better understand how to use bispecific antibodies. There are trials currently ongoing. I think they are very promising, but the issue in CLL is that T cells are impaired by the leukemic cells, so many therapies relying on T cell function probably require additional work in order to be as effective as in other lymphoproliferative disorders, also in CLL.